first child this season has died from the flu here in West Michigan. The child passed away yesterday.
And amid a spike in influenza this season, RSV hospitalizations are now on the rise too. I spoke to a doctor at Helen DeVos Children's Hospital to find out more. Corewell Health Helen DeVos Children's Hospital is seeing an increase in RSV patients admitted to the hospital.
4 times higher than it was around January of this year, and that's really driving a lot of our admissions to our children's hospital.
Dr. Kira Siplinga is the division chief of pediatrics. She explains this is the time of year they typically see RSV spikes, but this year it's a little different.
And this seems to be just a little bit higher than in seasons past.
Those who are affected most by RSV are typically newborns, infants, and toddlers.
If I got it, I'd have a common cold. But in infants and babies, because their bronchioles or the airway parts of their lungs are so narrow, they create a large amount of inflammation in those airways, and that leads to what we call respiratory distress or difficulty breathing.
This comes as influenza rates continue to be high since the holiday season. Both influenza and RSV have available vaccines to prevent spread and serious infections. While the hospital does not have data on vaccination rates for this season, they have seen previous trends.
In past years, it's typically about 90% of hospitalized patients have not received the vaccine.
As RSV cases continue to grow, Dr. Siplinga encourages keeping yourself or your child home when sick and continuing good hand washing. It's also not too late to get a flu or RSV vaccine, especially for those very young.
We don't generally test for RSV in the community. But I suspect that a lot of our respiratory symptoms in our younger toddlers are related to RSV right now.
And at this time, Helen DeVos is not restricting visitation at the hospital, and capacity remains manageable.